In this video, I want to share what I am doing during my fourth pregnancy to help optimize my thyroid health, because our thyroid function is so important for our pregnancy, for our birth, and then even into the postpartum period. I suffer from hypothyroidism, so my thyroid is on the low end of functioning, and so I'm going to share what I am doing to help support that during this pregnancy. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and the founder of MamasteFit, and I'm currently pregnant with baby number 4. And there are a lot of things that I'm doing during this pregnancy to help optimize my thyroid health, because I do have hypothyroidism, which means that my thyroid is on the lower functioning end. And so it's really important to support the health of my pregnancy, my baby's development, in addition to my birth and postpartum. And so I'm doing a lot of things to help optimize the function of that. But before we get into what am I doing during this current pregnancy, I do want to share my story of how I got to this point of learning that I even had thyroid issues, because I think a lot of us don't even know that we have any issues with our thyroid. And then also some things that may help you along your way if you are having some issues. So the way that I discovered that I had some issues with my thyroid was when my husband and I were trying to conceive our second baby. So our first daughter was about a year old, and we decided that this was time for us to begin to expand our family. And so we were trying, and then finally, after several months, we finally got pregnant, and we were so excited. But I had this kind of feeling of anxiety where I just felt like something was wrong, but I didn't know what was wrong exactly. And so we went in for an appointment at 9 weeks because I really just wanted to see the baby to make sure everything was going okay. And it was just like this blackness with the ultrasound. And the midwife was like, well, maybe you're just not as far along as you think you are. And I was kind of like, well, I might be like 1 or 2 weeks off, but I'm not like a whole month off. Like, there's no way that I'm an entire month off with figuring out what my due date is. And so we opted to go in for like a few more ultrasounds each week just to see if like maybe I was off on like conception date and wasn't as far along, or if maybe like baby was just taking a little bit of time to develop. And so as the weeks progressed, we realized that like this pregnancy was not viable and that we had had a miscarriage. And what that means is like my body was no longer pregnant or developing a pregnancy, but it didn't know that. And so it was just kind of continuing on like everything was normal. So after about like the 3rd or 4th ultrasound, we decided that it would be a good idea to help my body with this process of miscarrying, and we opted to take some medication at home to finish the pregnancy. After that, because I had a miscarriage, they were concerned for molar pregnancy, and so I had to go in every week to get my HCG levels monitored to ensure that they were lowering, because if they weren't lowering or if they started to lower and then increase again, it could be a sign of a molar pregnancy, which is a really big issue. Fortunately for me, I didn't have any complications from that pregnancy loss, and we were able to try conceiving like several months later after my husband got home from his deployment. So after he got home from his deployment, we began trying again to conceive our second baby, and we fell pregnant pretty quickly. But unfortunately, about a week after we found out that we were pregnant, I had a spontaneous loss. And so I started bleeding, I rushed to the ER, and that's where we found out that we had another miscarriage. And so after that, I went to my provider and I was like, hey, this doesn't seem normal to have 2 miscarriages in a row. Like normally folks, if they have one, will just have one and then that's it. But like it's really rare for folks to have multiple miscarriages in a row. But all I had been told was like, you have to have 3 losses before they will do anything about it. Luckily, I had a provider who was like really compassionate and really wanted to help me and knew that she didn't need to wait until I had 3 losses to begin to like figure out what was going on. And because she had a feeling that I was probably going to need more support during my pregnancy, she wanted to do a lot of blood work to see if we could find an underlying cause. So with that blood work, we found out that my thyroid was not functioning optimally, and I had really elevated levels of thyroid antibodies known as TPO. According to my provider, elevated thyroid antibody levels can be associated with recurrent pregnancy loss, so that could be why I was having all of these miscarriages. And so she opted to prescribe me some thyroid medication and then offered to do some more testing to see what was going on. During this time, my husband and I began to Google a ton to see if we can figure anything out as well in addition to her support. And we found out that elevated thyroid antibody levels could be due to inflammation. And so we opted to do the autoimmune paleo diet for a month to see if that can help reduce my thyroid antibody levels. And in that month, we did become pregnant with our son. And so my thyroid antibody levels were significantly lower. Those continued to get monitored throughout that entire pregnancy. And throughout the pregnancy, they got lower and lower and lower. And I really think it was because of the diet that I was doing. I was taking a lot of supplements to help support my thyroid health, in addition to the medication that my provider had prescribed me. And so we went on to have a low risk, no complication pregnancy with my son. And then even in the postpartum, he was totally fine with weight gain and everything as well. But my thyroid was something that my provider continued to monitor throughout my entire pregnancy to ensure that the levels were optimal. So from that experience, I learned how important my thyroid antibody levels were, and then just how important my thyroid function was to help support a healthy pregnancy, to support my birth, and also to support not only my health postpartum, but also my baby's, because our thyroid can also impact our baby's growth as well. And so after that experience, it became really important to me to be able to monitor my thyroid levels to ensure that they were functioning optimally, ensuring that I was eating food that was supporting like low inflammation, ensuring that I was taking supplements or medication to help support my thyroid health. And so now I want to share what all of those things are that I was doing preconception, during my pregnancy, and then even in the postpartum. During the preconception phase, about 4 to 6 months before my husband and I think that we're going to start trying for a baby, I start working with my provider to get a lot of blood work to make sure everything is functioning really well within my body, especially my thyroid. And so my provider and I monitor my thyroid levels every month to make sure that they're trending well, and if we need to, implementing like different things to help support it. One of the things that we do at our monthly appointments is I get B12 shots, which is just an injection into my arm of vitamin B12, which really can help with thyroid function. It also helps me because I have a little bit more fatigue, low appetite, and so higher levels of B12 can really help to support that as well. And so my B12 levels are on the low side, which may also be contributing to why my thyroid function is on the lower side as well. You can also take B12 vitamins, but I found the shots to be just much easier for me because I'm not always great with taking pills every day. And so the shots is like a really easy way for me to ensure that I'm getting the levels that I need every month. Another thing that my provider and I are doing is I started taking thyroid medication during the preconception of this 4th pregnancy. And so we started with a lower dose, and then over time we've adjusted it based on what my thyroid labs are looking like. And so my thyroid medication levels are a little bit higher during my pregnancy as opposed to pre-pregnancy because my thyroid function adjusts during my pregnancy as well. But we're monitoring my thyroid with blood work every 4 to 6 weeks to ensure that we are adjusting my medication based on how my thyroid is looking, which I found to be really helpful. In addition to the medication that I'm taking, I'm also thinking about taking additional supplements to help support my thyroid health. And so there are a lot of minerals and vitamins that can also help to support thyroid health, such as selenium, zinc, iodine, copper, magnesium. And so these are all things that are included in my prenatal vitamin. And so I currently take Needed's prenatal vitamin. It's like an 8-pill package that I take every day. They also have other options as well. If you're in your first trimester and pills are really tough, they have a powdered version. And if 8 pills is a lot, they do have an essentials version, which is just a condensed version of their prenatal vitamin. So I'm taking their prenatal multivitamin because it includes a lot of the supplements that I would need to help support my thyroid health as well. And then the last thing I'm doing is I'm trying to lower my stress levels as much as I can, and then also to decrease inflammation within my body. So things that I find that contribute towards inflammation for me and increase my stress levels is lack of sleep and not eating enough food. And so the first thing that I do to help address lack of sleep is I'm trying to go to bed at an early time, and I'm trying to sleep for at least 8 to 9 hours a night. Sometimes it's hard to do, so if I can, I'll try to sneak in a nap during the day, but ultimately trying to get a good night of sleep is really important to me. Other things that I do to help try to support getting a good night of sleep is I'll take Epsom salt baths before bed. I have this cherry tart juice mocktail that I'll drink to help enhance my melatonin release. And then I'm also making sure that I'm drinking magnesium during the day because that can also help with relaxing your muscles to help you sleep. The other thing that I'm really focusing on to help decrease my inflammation levels is to eat enough food. And I am notorious for eating like a bird where I skip breakfast and then I realize it's 3 to 4 p.m. and I haven't eaten anything. And this could be related to my B12 levels being on the low side to have a suppressed appetite or a low appetite. And so I do find that when I get my B12 shots, my appetite also increases, which is really beneficial for me. And so every Sunday, my husband and I essentially prep my meals for breakfast and lunch, and then we'll cook dinner every night. But when I have like a ready to go meal for breakfast, that's like really hearty. It includes like eggs and potatoes and like Brussels sprouts and whatever else we feel like including. It's much easier for me to grab that and eat as much of it as I can. And then same thing for lunch. I have this meal that's already prepped for me during lunch that I can just grab and eat. And so I'm not meal prepping in any attempt to like diet or to like restrict what I'm eating. I'm doing it for convenience because I don't have a lot of time in the morning with my other 3 kids and then also trying to get to work or doing all the things that we need to do. And so when the meal's are already prepped for me, it's much easier for me to make sure that I'm eating enough food and intaking enough calories. And so all of the things that I'm doing to help support my thyroid health during my pregnancy include sleeping enough, eating enough food, and I'm doing things to ensure that I'm getting a good night of sleep and then also eating enough food by meal prepping. I'm taking my thyroid medication, and my provider and I are adjusting my level based on my thyroid labs, which I'm getting done every 4 weeks. In addition, I'm taking supplements most days of the week. Sometimes I do miss some days where it's my prenatal vitamin, and then I also take an additional dose of selenium to help with my thyroid health. And my prenatal vitamin includes a lot of the vitamins and minerals that I need to help support my thyroid health as well. So those are all the things that I am doing during this first pregnancy to help support my thyroid health. And this is something that is really important to me because I have had issues with it in the past affecting my pregnancies. And so for me, I'm sleeping enough, I'm eating enough food to help with my inflammation and stress levels. I'm taking my thyroid medication that I'm working with my provider to make sure that the dosage is enough for me at any point in my pregnancy because our thyroid needs do adjust throughout our pregnancy as well. I'm taking my supplements to help support my thyroid health to include my prenatal vitamin, which has pretty much everything that I'm needing for my thyroid health, so I don't have to take a whole bunch of different pills. And then these are things that I am personally doing, so I'll link anything that I'm using personally in the notes below, but know that this is an individualized journey. So what I am personally doing may not be what is best for you. And so I would really recommend that if you are concerned about your thyroid or you're wondering whether or not you have thyroid issues, to one, listen to our podcast episode where we had Dr. Henderson talk all about the thyroid and signs and symptoms for you to look for. And then 2, to work with your provider to figure out if there is anything going on with your thyroid to see what steps you should take next. Because our thyroid is really important to supporting our pregnancy, our baby's development, our birth, and then also to help us heal in the postpartum period. So hopefully the things that I am doing to help support my thyroid health throughout my pregnancy is also helpful for you. If you enjoyed this video and you want more videos related to how I'm moving throughout my pregnancy, be sure to comment below to ask your questions. I'm happy to share my journey with you. If you enjoyed this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release 1 to 2 new workout videos every week and 1 to 2 educational videos every week to support your pregnancy, your birth, and beyond. If you want more support from me throughout your pregnancy, I have prenatal fitness programs to help keep you strong and moving throughout your pregnancy, in addition to a childbirth education course so that you can learn what your options are for birth, the science of birth, what is even happening. Because some of the reason why we may be afraid of birth is we just don't understand it. And so when we understand what is a contraction, how does it function, how is it even working, it can make birth a lot less scary. So you can check out all of our online courses on our website at MamasteFit.com. And as a thank you for listening to this video and hearing about my journey, you can use code YouTube10 to get 10% off.